Aria Health, a company showcase.
Hi everyone, my name's Georgina and I'm the CEO and co-founder of Aria. So I started Aria more than 4 years ago when I was doing my master's in blockchain. Now at this time, my co-founder's wife, Fadi, was rushed into hospital. She was in agonizing pain and made to wait for more than 4 hours while they frantically searched for her medical data. Eventually, it was just by luck that a doctor that knew her came by, rushed her through for an ultrascan, and on finding she had an ectopic pregnancy, took her through for emergency surgery. She'd lost 3 liters of blood. This is when we realized that we have access to so much information, but not to our most important data, our health data. And that we're sitting on these technologies like blockchain, which are uniquely designed to unify this ultra-sensitive data in a much more secure and personalized way. But it's not enough to just be able to respond to a health emergency. As our population grows, the number of doctors we have decrease, our healthcare costs are rising, we need to change our approach towards a preventative health method. We need to focus on health and not on sickness. And in fact, what we've seen in the EU is that 11 million lives would be saved by 2040 if we looked after our health better. 2.3 trillion euros would be contributed to the GDP of Europe. And the average 65-year-old would have the quality of life of a 55-year-old. And the exciting thing is we're actually starting to have the technologies which can achieve this. We've seen huge advances in AI and NLP to be able to predict health outcomes. We've seen population health analysis be able to know and respond better to pandemic and epidemic situations. We're seeing decentralized healthcare, clinical trials, being able to involve more diverse populations. But what we need to actually be able to power these are 2 things. First, we need data. We need to leverage data to drive data-driven insights. But second, we need patients. We need to empower patients to be involved and be proactive in their health. Now, currently, there's a lot of focus on part 1. Everyone talks about the data, let's clean the data, let's unify the data, let's, protect the data. But there's very little focus on part 2. And in fact, what we see is that this data is being transferred between organization to organization without the involvement of the patients. We see cases like, on a private basis, 23andMe, who sold 10 million DNA records to 𝐒𝐿 for $300 million. We see at a public health level with the NHS UK, who's allowing private businesses to access more than 55 million patient records. And this is achieving the opposite of what we want to. It's disempowering patients. It's making them mistrust the system and withdraw information. What we need are solutions which foster transparency, collaboration, and equity. And what that means is engaging the patients. When we engage the patients, we can have much better health outcomes. We can be proactive. We can increase the amount of data that's available, both by them agreeing and consenting to share their clinical data, but also they can enrich their clinical picture with real-world information, with data from their wearables, with patient-reported outcomes, lifestyle information. And this can all be done in a much more efficient way when we actually engage them throughout the process. And this is where blockchain is really uniquely designed for this. It's the first technology that actually bridges the gap between who owns the data and who controls the data. We make that one person and are able to finally unify it, make it patient-centric, and make it a more efficient peer-to-peer solution. Now, we have already launched a solution in 2 hospitals within Europe. We have more than 7,000 records and patients using this at the moment. And we've really focused on that experience for the patients. We make it very easy for patients to connect with their healthcare providers, request their medical data. We automatically transfer all their historical data into their blockchain wallet, where it's completely private and only accessible by them. And then we give them tools to understand that data. So we make it more engaging, for example, and you'll see in a second, you can see, highlight which results are in around a range, do comparative analysis, see how your bloods have been moving. And then we give them the tools to share that data so they can select doctors, what records they want to share, and be able to trace at all times who is accessing what data and what are they doing with it. We're now taking this to the next level with our international partners. So we're now working with public hospital groups with more than 80 hospitals worldwide to say, okay, now we've got this amazing solution that can secure that data. What can we do with that data? How can we really expedite the future of health, but keeping it a democratic procedure that incentivizes the patients to be involved? So again, now that we've got your data on your app, you're now able to have patient-led, compliant ability to give consent that, yep, I'm happy to have these third parties, these researchers, these universities, these health tech solutions be able to get access to my data. And I can choose what type of reasons I feel comfortable that data being used. We then reward the patients financially. So rather than, GlaxoSmithKline paying 23, we use smart contracts to distribute the payment back to the patients, as well as to the healthcare providers and all the people that are involved to make this possible, but the primary focus being on the patient. They can then use that data either to subsidize their medical journey. So our partners, for example, will say, you know what, double that balance and you can use it in our hospitals. And that's incentivizing loyalty and keeping them within the ecosystem. They can contribute to research. They can contribute to charities. Or they can go and buy themselves a healthy dinner. So use it for what they want. And then we take this a step further about giving them much more information about what happened to that data. So you don't just want it to go into, this black box. I consented some people to have access to it. We now give the tools for example, a pharmaceutical company to say, you know what, we use your data in a research study, and this is the impact it had. This was the medicines which were developed. These are the people that were impacted. This is how you helped your community. And this really is important for people to feel like healthcare is a positive and a great industry, and I want to be part of it, and I want to engage in it. And then through this, we've created peer-to-peer connections between the patients and the data users, which then allows us to have follow-up with the patients. So, for example, they can request additional medical information. So it's going to enrich that clinical picture with real-world data. And then they can also find patients and be able to match them to clinical trials. And we can do this all anonymously, pseudonymously through the blockchain to be able to request patients for clinical trials and have those decentralized clinical trials, which are becoming very popular now. So thank you for your time listening today. We really believe that the future of health is going to be unlocked through a collaborative, transparent, and fair approach. Thank you.